I served as a chairside dental assistant for nearly 15 years. Throughout my journey, I gleaned valuable knowledge from various dentists and assistants, and now I feel so compelled to impart my wisdom and dental expertise to support others on their path. So please glove up and join me, Ruby Jones, your favorite dental diva, as we strive to enhance ourselves together. Great day, everyone. Thank you for tuning into this video. I am going to be bringing you guys along today for my father's dental appointment. So it is an emergency appointment, so I'm not sure exactly what's gonna happen today, but just to bring you guys up to speed, last week sometime my dad was complaining about pain, tooth pain. The next day or so, his entire face was so swollen, like extremely swollen, bringing him, this grown man, to tears. Just, he was in excruciating pain. So my sister, I wasn't available, so my older sister took my dad to urgent care, where, from what she explained to me, there was like a large abscess, a lot of infection. They decided to drain it. Okay, so they decided to create an incision and drain the fluid that was causing that inflammation and swelling and just that abscess, right? Again, I was not there, so I don't know exactly how bad it was. I'm sure it was bad. But today is his appointment, his follow-up appointment with a dentist here in Matthews. So I'm driving out taking my early lunch to meet my dad there, so I can be there with him when they are going through the examinations, when they're taking x-rays, and just to kind of see and bring you guys along. If I can share or take some videos and talk through the x-rays, I'm going to want to do that. And just maybe my dad will let us look in his mouth. I don't know. Maybe he'll let me videotape it so we can see. And he's just a little backstory with that. Actually, he just has not done his job with keeping up with his oral health care, his oral health. He, to different reasons, for different reasons. But us being in our field, we are never the ones to judge. A great assistant, a great dental professional is going to meet our clients, our patients, where they're at. No judgment. Let's talk about solutions. Let's talk about treatment plans and how and when we can go about completing a treatment plan to get this individual where we need them to be health-wise and where they want to be, where they desire to be. Okay, so no judgment, but this is where we are. And I'm like, you know what, let me try to film a video and see how much footage I can get while we're in the appointment, and of the things and just the experience. So yeah, hopefully you enjoy this video.
Just the HIPAA, confidential information, your medical, dental,
Very cute, small office.
and just always.
We're in this first room.
This one.
Oh no, this one's what? And you can go ahead and take a seat right here. This wide chair. How are you doing today?
All right.
Good.
Okay, y'all, now it is time to brief with the patient. So she is asking him what brings him in today, trying to narrow down the problem area. How has he been feeling? What triggered it? Just those questions that she wants to get out the way before she calls him back to take an x-ray.
You can go ahead and take a seat right here. Take a seat facing that way.
So you can get everything done in here.
And then turn around. Right here. Alright. Then I go ahead and place this right here. Go ahead and open a little wider and bite down. You'll feel like some ridges right there at the front of that stick. You can scoot as close as you need to too. Go ahead and smile.
Real quick, but such a big deal. This is one of our graduates from DA Academy. So they just took the panoramic, and then she's gonna take some PAs here.
You want to take the inside? So you
Yeah,
can
that's
see
the
how
Nomad. That's the mobile X-ray machine.
I'm gonna go ahead and put this wet apron over you. If you could set up all the way in the chair. There we go.
Alright. Go ahead and bite down all the way. I'll kind of help you hold it in place, okay?
Okay, so I'm gonna go ahead and let her get situated or get his PAs done because she already did his panel. I don't know how many PAs she's gonna be able to get because he's missing a whole lot of teeth, and that just makes me feel so sad because I'm like, Dad, how have you been eating? Like, how are you eating? And he's like, using my gums and it hurts, which sucks, and nobody should have to use their gums to eat, you know. And so I'm just trying to do better and be here to support him so that we can get a treatment plan and we can at least start and finish this treatment plan because he needs to eat and he needs to not just come to the dentist when he's having pain or swelling or inflammation. He should be coming just to get his ordinary cleanings that he needs. The dental office is not, I mean, it's there for emergencies, but you shouldn't just be going to the dental office when it's an emergency, you know? So let's go see if the PAs are done and how many. My dad has been a great patient by letting us look into his mouth. So we'll see a lot of videos, a lot of pictures of what it looks like in there.
And then this was the one done in the other mouth. There you can see your little area. I'm just gonna take this to my room and I'll be right back. Okay, we'll start from the beginning.
That's the broken one I saw. Wow, it's nice. It's gonna guide you through the whole mouth to do the intraoral photos. Oh, that's really cool.
It usually says the numbers of the teeth right there where it says object, but it's been glitching for a little bit.
Okay.
Yeah.
Oh my goodness. So these are intraoral photos. Just digital images. Very large fillings.
bite down a little bit. There we go.
That's that broken tooth he was talking about. His anterior teeth. His anterior teeth are so worn.
I'm gonna go ahead and hand you these glasses so you're not blinded by her light.
So 5 is actually there. It's a root tip, so I would change that from missing to being a root tip. So 20 is also a root tip. Extracted because it's already loose and it has that much bone loss around it. So once this one's extracted, we can hold on to this one at least. It would be a good anchor for partial. And we can have a partial up until here. Like this canine, he still got solid teeth. I mean, this tooth is like rock solid right there. Maybe some gum things going on. But if we can get a hook here, maybe like even an eye bar, a clasp, yes, an eye bar there. So give him, I would recommend cast metal partials for both.
Okay.
Like that would just be the best for him. We'll take these two out, do the same thing, build all of this. I'll take this out, take this problem tooth out, it cannot be saved. So, all right, let's go so I don't just forget about it. All right. We're gonna do EXT root tip 21. We're gonna do EXT 28. We're gonna EXT 24 and 25. Now we're gonna do, I'm gonna call them MIDFLs, starting from 22, 23, 26, and 27. Those would be all MIDFLs, just composite buildups on them. EXT, Surge EXT of 4, so that root canal, Surge EXT of 5 as well, that root tip. 6, we would do an hold on, 6, maybe I can just do a lingual on that one. So 6 do an FIL, 7 MIDFL, 8 MIDFL, 9 MIDFL, 10 MIDFL as well. 11, let's make that just a lingual, because we're not trying to build up your teeth to be too high at this point. And then EXT of 15, and then write cast RPDs, top and bottom, max and mend. Four, 3, 4.
Okay, y'all, so I will probably be doing a part 2 of the actual treatment, but long story short, the doctor did the exam. I mean, she did the radiograph exam, the clinical exam, the soft tissue exam looking for cancerous signs. She did the soft tissue. She did a very amazing exam. She actually even did perio charting, which you guys will see in the video, where when the doctor is doing the perio charting, the dental assistant is entering in the perio numbers into the chart. But basically, she is proposing for him to get a bunch of extractions and keeping, of course, the very solid teeth. She wants him to get cleanings to help with the foundation, the gum tissue that's remaining around those teeth that's going to stay, and upper and lower partial. So because we are in here for the pain on the lower right, he is going to get extracted. I want to say 27 or 28, I'm not sure, but he's getting one of those extracted. So that is the part 2 video that I'm going to record, but I'm going to make that separately so that this video isn't so super long. Okay.